Today we will be reviewing how to splint and immobilize a joint injury. When splinting a joint, the splint should immobilize the long bone above and below the injured joint. After assessing and managing any life-threatening injuries and completing the primary and secondary assessment, it is time to splint and immobilize this patient's shoulder injury. To do so, utilize a sling and 2 swathes to ensure proper immobilization of the shoulder by securing it to the torso. The first step is to have an EMT partner or the patient immobilize the injured extremity to prevent causing pain to the patient during the splinting process. Next, the EMT will assess the injured extremity's circulation, motor function, and sensation. The pulse can be assessed by palpating or checking the capillary refill distal to the injury. Motor function is assessed by asking the patient to wiggle their fingers on the injured extremity. And sensation is assessed by asking the patient if they felt the palpation, or by touching the patient's finger and having them localize the sensation. Then, the EMT selects the appropriate splinting material. For the shoulder, use 3 triangle bandages. The first triangle bandage should serve as a sling, with the elbow resting in the corner of the triangle bandage, and the other 2 corners being secured behind the patient's neck. Secure the elbow and forearm so that the wrist is higher than the elbow to prevent swelling in the wrist and fingers. Ensure the triangle bandage is spread across the length of the forearm. Roll the other 2 triangle bandages and wrap them around the injured arm and the patient's body. It is easiest to wrap them under the patient's uninjured arm. A second triangle bandage can be placed similarly, such that one triangle bandage secures the upper portion of the upper arm to the body, and the other secures the lower portion of the upper arm to the body. These 2 triangle bandages are called swathes and prevent the arm from swinging forward or back, causing pain in the patient's shoulder. Remember to ensure the splinting reduces joint movement as much as possible. And finally, reassess the patient's circulation, motor function, and sensation. Thank you for reviewing this Falck Health Institute skill video. Please like and subscribe for future videos.